I came to the floor today, Mr. President, to talk briefly about a hearing we had yesterday in the Health Committee on the next pandemic. What do we need to do to prepare for the next pandemic? Well, that caused at least one senator to say, what are we doing talking about the next pandemic when we're in the middle of a big one right now? We've got a lot of work to do. We do have a lot of work to do, but I want to answer that question. The reason we need to talk about the next pandemic is that we have short memories. Memories fade. We go on to the next issue, and we don't do everything we needed to do. We've had public health emergencies before. Some members are still here when anthrax drove senators from their offices. There was SARS. There was a 2009 flu pandemic. There was Ebola. There was MRSA. And 4 presidents, Bush, Obama, Trump, Clinton, all reacted to those in the way you would think. They issued reports, they made proposals. We passed 9 laws, many new regulations. We tried to do some things to be ready for the next public health emergency. We built buildings to manufacture vaccines. We created a new structure for managing a public health emergency. We changed the way that the national stockpile is managed. We did a number of things. One of our witnesses yesterday was Senator Bill Frist, who was the majority leader during the mid-2000s. He said he made 20 speeches on and about 2005, where he said the only question about the next pandemic is not whether it's coming, but when it will come. And he listed 6 things that needed to be done back then. Well, the reason we had the hearing yesterday was we didn't get all those things done. Now, some people might say, well, weren't we prepared for this pandemic? And most experts thought we were pretty well prepared. I read yesterday in the hearing a front page story from the New York Times on March the 1st of this year about COVID-19. In it, it said that most experts, now let me just go back, March 1st, that was 6 weeks after we knew about the disease. At the time, we had about 100 cases in the United States, only 2 deaths. There were many cases around the world. But at that time, the New York Times reported that experts doubt that this disease, experts say it is far from certain, is what the word said, that this disease will spread to all parts of the country, especially at the same time. And experts believe that the United States is as well prepared as any country to deal with this pandemic. That was on March the 1st. And 2.5 weeks later, we began to shut down the whole country by order of the governments of this country. So we were prepared, but we were surprised too. And we underestimated this virus and how aggressive it is and how contagious it is and the fact it can travel silently without symptoms. So Dr. Frist was one of the witnesses yesterday. Mike Leavitt, a former secretary of the Health and Human Services, former governor of Utah, was another. Julie Gerberding, who was a former head of the Center for Disease Control, was yet another. She's now at Merck. Dr. Kalban, who is the chief medical officer of the state of Michigan, was there. And we talked about the next pandemic. And why talk about it now? Because the things that Dr. Frist mentioned 20 years ago and the things that really need to get done, we didn't get all done in between pandemics. Why? We have short memories. I mean, 4 or 5 months ago, we were in the middle of the impeachment of a president. That sounds like ancient Roman history today. But our minds go on to the next crisis and we don't get things done. So the time to look at the next pandemic is while we're in the middle of this one and say, what are we lacking? What could we do better? And let's fix it while the iron's hot, while our eye is on it. For example, one of the things that they suggested that we do, all the witnesses, is that we have a dedicated source of funding for stockpiles and for research. You think that's easy to do? I don't think it'll be easy to get done. It took us years to pass the outdoor recreation bill, the Great American Outdoors Act, because of those kinds of funding issues. We're more likely to create a dedicated stream of funding for preparedness for the next pandemic if we do it in the middle of this pandemic when we've got our eye on the ball. Another recommendation was that we should have an office in the National Security Council to provide coordination between epidemics and during the next one. That's not easy to do either. When is the best time to do it? Now during this pandemic when we've got our eye on the ball. Another proposal that came up very often was that we ought to build manufacturing plants for vaccines that we don't use between pandemics, and that we ought to spend the money to keep them open and warm, in the words of Mike Leavitt, so that they're ready when suddenly a pandemic comes. Remember, this one hit us fast. Not many cases on the 1st of March, shutting down the government by the end of March. And we need those manufacturing plants, and that's something that we haven't gotten done in the way we should have gotten done, did some of it. When's the best time to do it? Now, while we have our eye on the ball. Strengthen our state and local public health system. Governor Leavitt said that over the last 40 years, we have consistently underfunded our state and local public health systems. They are the leaders in our effort to deal with this pandemic or any pandemic, including the next pandemic. When is the best time to get over this bad habit of underfunding our state and local public health system? Right now, while we see that we need it and while we see what deficiencies it might have. And then on stockpiles, in between some of these earlier pandemics, we changed the management of the stockpile, spent some money to make sure that protective equipment is in there and the other things that we need, but it turned out not to be sufficient. And why was the problem is because between pandemics, we took our eye off the ball and budgets got tight, and states and hospitals began to save money by getting rid of the things in their local stockpiles. So for all those reasons, the things that we need to do need to be done now. I put out a white paper a few weeks ago inviting comment from experts around the country on what do we need to do now to be prepared for the next pandemic. Item 1 was tests, treatments, and vaccines. How do we accelerate research and development? We're doing a good job of that now. What can we learn from that about the next pandemic? Disease surveillance. There's a lot of criticism of the Center for Disease Control inability to gather all of the data that it needs to track diseases, emerging diseases, in a way that it should. Now's the time to deal with that. Stockpiles, distributions, and surges in hospitals. We had to shut down hospitals, elective surgery, creating enormous costs all across the country. We had to come up with $175 billion just over the last 3 months to try to help hospitals recover that. Can we not do a different job of preparing for the surge of patients that will come with a pandemic? Maybe the best time to do that is while we're in the midst of a pandemic. And then public health capabilities, I mentioned strengthening the local public health system, and then who's on the flagpole? Is there a better way to have a sort of supreme allied commander of all the various agencies that we have today? Those plus the need for dedicated funding, Mr. President, are difficult issues. The answer to the question, why in the world are we having a hearing on the next pandemic when we're in the middle of this one, is because for the last 20 years between pandemics, we haven't got the job done on some of the things that need to be done that Dr. Frist mentioned when he was majority leader in 20 speeches 20 years ago. So if we can't do it between pandemics, let's do it during a pandemic. And that's what our hearing was about. It was a good hearing, terrific witnesses, good suggestions. At the end, I asked all 4 witnesses to please summarize the 3 things that each one thought should be done this year if they could. As it turned out, they're all hard to do. And second, most of them will not only help with the next pandemic, they will help with the current one that we're that we're in. So I wanted, that was our fourth hearing this month by the Health Committee. We've had a hearing on going back to school, college safely. We had one on going back to school safely. Those two hearings made clear to me the need for us to consider, if we have another piece of COVID legislation in July, that it needs to include sufficient funds to make sure our 100,000 schools and 6,000 colleges can open safely in the fall. The way to open the economy is to go back to school and back to college and back to childcare. That'll get us back to work. 2/3 of the married families in this country have parents, both of whom work outside the home. Children aren't learning when they're let out of school in March and don't go back to school for several months, and maybe even 6 or 8 or 10 months if they don't go back in the fall. So there is some health risk, but if we do our job here and provide sufficient funds in July to make sure our 100,000 schools and 6,000 colleges can open safely, that will be the surest avenue toward normalcy in the year 2020 before we have a vaccine. We also had a hearing last week on telehealth. We've had 10 years of experience crammed into 3 months. We've gone from very little telehealth, medical services delivered remotely, to in some cases 40 or 50% of the doctor's patients' visits are remotely. Many people think that will level off at 15 or 20%. That would probably be the biggest change in delivery of medical services in our nation's history. I can't think of a bigger one. It's hundreds of millions of visits would be done remotely instead of in person. And I've recommended that at least the 2 major changes that we've made temporarily in telehealth be made permanent. And then yesterday was what to do about the next pandemic. And then next Tuesday will be our 5th hearing this month. And it will include Dr. Fauci and Dr. Redfield and Dr. Hahn, Admiral Giwa, who will give us an update on going back to school, going back to college, and going back to work. Mr. President, I ask consent to include in the record my opening statement from yesterday's hearing. I yield the floor.
Without objection.